Well, good evening, everybody. My name is Dr. Tanuj Nakra, and we come to you live from Mumbai, India, with another episode of Hair Talks. I am actually reporting from Austin, Texas, in the United States, where it's 8:30 in the morning, and that highlights one of the beauties of this organization, where we are around the world simultaneously. So, a little history on global cosmetic surgery. In the depths of the pandemic, we were all hunkered down. Nobody was going to conferences anymore. And we were really missing each other, missing the academic camaraderie and the ability to share ideas in real time. And, to quote a famous 80s band, Cinderella, you don't know what you've got until it's gone. And so we were feeling that void back in the 2000 era, 2001, and Deborah Shom in Mumbai and I came together with this idea to bring the world together on an educational platform that was free for everybody. And that's where Global Cosmetic Surgery was born. And we all know that virtual learning exploded during the pandemic. It has become a new way of educating and enjoying each other's company. And even though this is our first live session for Global Cosmetic Surgery, we also are featuring people from around the world who are panelists and enjoying the company of attendees from around the world. So welcome aboard. And also to quote another 1980s band, Sting, it's a brand new world we are in now, where we have hybrid education, and it's really the best of both worlds. So I would like to take a moment to thank the technical team for bringing together a very complex meeting that's happening both live and virtually. And we are really excited to have Dr. Michael Gold as our keynote speaker, our first live keynote speaker, to be exact. We've known Dr. Gold for years. He is a leader in the field of dermatology and hair. And I'd like to give him a detailed introduction just before he gives his keynote address. In the meantime, I do want to welcome some very special panelists that we have here today who will be helping to moderate the session and also offering their own insights after Dr. Gold has given his keynote talk. I want to specifically introduce Dr. Kavish Chauhan and Dr. Navneet Harar, who are there in Delhi with Dr. Gold. And so Dr. Kavish Chauhan is a dermatologist, board-certified hair transplant surgeon, is the director of the Derma Clinics and a renowned hair transplant surgeon, an alumnus of All India Medical Institute, New Delhi, which is India's premier medical institute, as everyone knows in India. He's recognized for his expertise both in clinical dermatology and advanced hair restoration. He has authored numerous publications in journals around the world and contributed to leading textbooks. Dr. Navneet Harar is also an internationally acclaimed expert in transplantation and aesthetic medicine with advanced fellowships in hair transplant, dermatologic surgery, and laser aesthetics in Singapore. A recipient of the Governor of Uttar Pradesh Gold Medal for Academic Excellence, he's trained over 14,000 clinicians across 22 countries in dermatology, plastic surgery, and aesthetic procedures. Dr. Harar is a sought-after international speaker and trainer, known for leadership in global wellness as well as aesthetic innovation. We also have this evening coming to us virtually from Mumbai, Dr. Mahesh Gasavi and Dr. Vinay Choksi. Dr. Ahmad Yusuf is from Kuwait, visiting us virtually, and also Dr. Imran Ali from Hyderabad. And so now we will shortly have Dr. Gold take over and give us his keynote lecture. Dr. Gold will be speaking on modern milestones in hair restoration from biologic intelligence to technologic precision. His lecture will highlight how advances in robotics, instrumentation, and regenerative medicine are transforming the field of hair restoration. Now, before we let Dr. Gold speak, let me just give you a little personal introduction. He really is a wonderful human being. For someone who is so famous internationally, leader of so many organizations, he is surprisingly humble, down to earth, and personable, the kind of person you'd like to have a glass of scotch with and just chat about philosophy, not just hair. Uh, but you do need to know a little bit about his academic background. So let me fill you in. He's a world-renowned dermatologist and dermatologic surgeon. He's the founder of the Gold Skincare Center in Tennessee, in Nashville. And over the course of his career, he's been instrumental in developing and bringing to market numerous pharmaceutical products, medical devices, and aesthetic technologies through his extensive clinical and academic research. He's published very widely, trained countless physicians, and is amongst one of the most sought-after speakers in our field. He presents not only at conferences around the globe, but he actually runs many of them. His contributions have really shaped the clinical practice of aesthetics, innovation in our field, and we're very privileged to welcome him today as our keynote speaker, live in person. It's off to you, Michael. Thanks for being here with us.
Thanks so much. Thanks everybody for coming virtually, in person, wherever you are. I think this is going to be great, and I think we're going to be able to share a lot of things with you on what we're doing. And I'm just trying to get this screen working the way I want it to. So um, my helper's helping me here. I want to get rid of that. There. I don't want this. Screen. Okay, we're good. All right. Well, again, thanks everybody for coming on and being part of this. Um, and it's been a wonderful having Global Cosmetic Surgery around has been great. Um, Bringing all the different aesthetic fields into one environment when we were sort of staying at home and worrying what the heck we were going to do and would we be learning. So congrats to Tanuj and Debraj for putting this together. And as a dermatologist, we play an important role in aesthetics, and having collaboration with our plastic surgical colleagues is makes it very special and very worthwhile for everything that we do. So it's been really a lot of fun to participate in this over the last several years. And then somehow a couple years ago, Tanuj and Debraj said, would I organize with them with this concept of HairTalks? And we've done incredibly well doing them. We thought we'd do them once a month, but it's like once a quarter. And we get thousands of people online, and we bring different people in to give that we call the keynote speech on different aspects, whether it's been on what are the new treatment options, or is there a gut influence on certain medicines, and all this other stuff that I don't really think about all the time. So we learn from each other, and that's the key of what this whole thing is about. And so having this one tonight here in Delhi is very special because we've got Delhi live, Mumbai live, Hyderabad live, Kuwait virtually, and then everybody around the world. So I'm here to talk about what I do, what I like to play in the thing. So when I sent the QR team or the Hair Talks team the slides, there were almost 800 slides. Okay, so we're not going to bore you with 800 slides, but I actually give a several-hour session on hair growth from A to Z, if you will. So I'm a dermatologist. I'm based in Nashville. Before the pandemic, I spent an inordinate amount of time in China, where I have lots of academic appointments in both derm and plastics. I do a lot of laser work. And I'm the editor now of 3 journals in dermatology. So I keep busy 20 hours out of the 24 hours in every day. The journal never shuts down, and it's a lot of fun. I do put a conflict of interest, which is number three. If it's something in the hair space, over 30 plus years of work, then I have been working with companies. And I think that's important. Um, Hair restoration, I won't spend a lot of time on this, but it's a huge market and it's often neglected by clinicians. Although if you ask your patients or take them seriously when they ask you about it, there's so many things we can do today. And again, there are non-surgical techniques, there are surgical techniques, and the concept that I want to make sure everybody understands is, we sort of we look at them, but we always don't look inside of our patients. Right. And so how much does this bother them? What is their self-perception? What are their psychological functionings? There are men out there more so than women who shave their heads every day because that's the look they want to be. And that's fine. That they're good with that. But there are others that it can lower if you have hair loss or beginning hair loss or a lot of hair loss, it decreases your self-esteem, feelings of personal attractiveness, and that can lead to other issues, right? So there's lots of treatments for hair loss, and what I'm not going to talk about is there is you have to do a complete history and you have to do a complete physical exam on these patients, and you also have to do laboratory studies where appropriate. Because if they have an underlying disease, we have to treat that. And again, if you're in the hair loss business or hair growth business, you have to know how to look for things that cause people to lose hair, and then we can fix them appropriately. So let's see. Again, this is a very concerning thing. People are very concerned about hair. And every survey that you look at, this was a hair survey. So hair loss is the top of the list. I'd be more concerned personally if I had heart disease or something else. But the people that have a lot of hair loss, that is really bothersome to them. And again, if you look, 88% of men worry that they'll be less attractive and not as confident with their hair loss. So it is a big deal, and it's something we need to talk about. So we'll start in the surgical world. Then we will go into the more medical and regenerative world toward the end, and laser world toward the end. So the first hair transplant, let me preface this by telling you about me and hair transplants. So I started residency over 40 years ago in dermatology. My first day of residency, I did a hair transplant. I thought that was amazing. The first patient I ever saw in clinic after we all introduced ourselves, I had to go to one of the clinics, and that day was hair transplant day. And I'm like, this is very cool. Never had seen a hair transplant, but I thought it was really fun. My second day of dermatology residency, I got sent to a liposuction clinic, and we did 2 liposuction procedures. And I'm like, okay, I picked the right residency because I'm going to be doing this all the time. And the third day, who's a dermatologist in here? Okay, so there was a textbook by Fitzpatrick. It's like 5,000 pages long. And they handed me the textbook the next day, and they said, in 3 years, you'll have this memorized, so get used to reading. And I'm like, no, I want to do hair transplants and liposuctions all day. But that's how I got trained. So we were a hair transplant center I trained at Northwestern University in Chicago, and we did hair transplants and liposuction. So in dermatology, this is 40 years ago, we were so far ahead of the curve of learning and so forth. And my teachers were monumental in making me want to pursue not only a derm career, but a derm anesthetic career. All right, so the first documented hair transplant, 1822. Okay, I didn't know that. I actually went and searched all this. And my first types of hair transplants were punch technique. All right, I started with the punch technique. And that was how we got the term hair plugs, and unnatural looking results. So when we do them today, obviously we're doing single haired, 1 or 2 hairs and whatever. And then we started strip grafting. So we had strips where we just took 1 scalpel blade and made a strip in the back of the head and did it. Then we got fancy and had a little attachment so we could get 2 blades, make 1 strip, and then sew it back together. There was one time I had 3 blades so I could get 2 strips at the same time. And then you had to meticulously go through everything. But this change to follicular units, 1 to 3 grafts, and then now one hair graft period is what we do now. And they are and follicular units are how we grow hair. And again, we do that now and so forth. So the device world, this is the one that started it in my world. So I used to do all this by hand with my technicians, and we'd cut and do everything and take out everything meticulously. And NeoGraft was the first device that came to be where we could have like a machine do the excision of the grafts for us, or the extraction. So let's go through a brief history. So if you're in the hand transplant world, you may have heard of Dr. Jack Fisher, who became my partner for many years at the end of his career. And Jack and I did a lot of this together. But this is some of his work. So again, this is what we don't want, right? This is Barbie and Ken, and that's how we started. Then we went into this follicular unit with the strip method, and it worked amazingly well. But we did see in the back of the hair, we saw this line, and sometimes 2 lines if they needed another procedure, and when we could finally run out. And what you can see in the black down at the bottom, the follicular unit extraction, this is how we do it today, right? And that's important. So again, this is the closure with staples or sutures. But patients, we were happy, they were happy with the front of their hair, but they weren't happy with the back of their hair. And so being able to use NeoGraft with this minimally invasive approach allowed us to do these 1 millimeter hollow punches. And then the punch the punch would actually go into the cylinder to collect them. Then we could actually cleanse, trim them, clean them, make sure they were appropriate. You still need to be skilled because you need to extract it so you don't damage the hair and you're in the right plane. But this worked, and this is a video showing what it does. And again, it takes time, as all hair transplant do, but you can see here how the entryway is, and you're able to extract. But the good part about it is, how it looks. So this gentleman, 48 years old, right, on the left side of the screen, 55 years old on the right side of the screen. He lost a lot of hair, right? That's what he looked like after his hair transplant. All right, so he's 55 on the right side. Got his eyes fixed, I think, or took his glasses off. But I think it's impressive when we can take somebody and change them. I say that all the time in everything I do in my world, and I do a lot of scar work, and we can change lives. So again, taking somebody that looks like this, morphing them a little bit like this into a different person. He changes his life, it changes his thing. And again, we not only see better hair, but we see better skin as a result because he starts to take care of himself better. So it definitely, getting a hair transplant is not just all about hair, it's about what else we can do. So which laser can he have done? What skincare routine? And again, this is pretty advanced technology. These are some of the before and afters of using NeoGraft. Definitely works, right? If you have the right team, this is pretty nice. You can do men and women. You can do front and back of the hair or the vertex of the hair. Skin colors don't matter. And again, these are some of my patients that early on when we just were getting used to how to do it. But again, we were able to create hairlines and happy patients in what we were able to do with these people. So then, of course, once you get used to the machine, you get a little more aggressive, and we implant it. And what you see in the donor site is it's really all healed within a week. And that's a key advantage. And if they go swimming or whatever, most people will never notice this. And I think that's also impressive. So again, this NeoGraft worked. And unfortunately, this somehow is on its own thing. But this is the new standard, right? And artist has gone through many versions of things, and this is a true AI robot. And it really allows you to do single hair extraction from the donor site and implantation if you want, with the patient doing it. Now, having said that, I do a lot of the only thing in the donor site is I use the AI and the grafting techniques with this machine, but my team and I implant every hair. I think we're still better than the device, but the device works, and I'm not going to say it doesn't. So let me go get back to where I wanted to here. Um, so it's a harvesting, simultaneous recipient site making and implantation. It has the capabilities to do everything. It is very sophisticated. And this will stop in a minute. We've already tested this a whole bunch. The robotic arm is easy to use for our patients. It's not uncomfortable. It's again, the newest versions of this are much more user-friendly, and we're able to get very high yield grafts. So I did a hair transplant this past week, 2,000 grafts, and we used 1,975 of them in our recipient area. That was impressive because we didn't have to get rid of them, and just 25, I think that's okay. And again, it optimizes the harvest selection, and you can use it to implant the hairs. Again, we like doing it ourselves, but that's okay. It's a slimmer profile and more treatment, the newest version than we've had before. And the benefits this is it makes my staff much more efficient. And they feel more comfortable. The fun part of it, they feel like they're playing a video game most of the time. And they're younger and they like video games, so they get to actually play and do it that way. So it's precise, it's accurate, and it's reliable. And this is how it works if you've never seen it. And we won't play the whole video just to stay on time. But it's really nice, and then there's the AI screen that you're doing, and it'll ask you whether you want to harvest, and then the technician just goes and you just take out single hair after single hair after single hair. And again, that's really nice, and you can see here. And you see this magnification. This isn't blown up. This is the actual look of the screen that the people are looking at when they're doing the procedure. Okay, let's go on. And so again, we're able to extract everything the right way, and get what we want with what we're doing. So, and then again, we get better graphs, much more user-friendly things, and we'll show you what this does here. So before and after, again, really nice results. Another patient before and after, and these are all from my clinic, and what we do with it. And I think these are happy. This is actually reverse. This is not reverse. This is fine. Again, we fill in where we want to fill in. I think the key to this is not making false hairlines in the front. Again, everybody here that's in this room, that you nod. I'd rather go back a second procedure and lower the hairline a little bit. But most of my patients are wanting this more full hair look and more full hairline, and they're not necessarily interested in creating something that doesn't look real. And I think we're able to achieve that with the ARTIS and NeoGraft. Obviously, over here, that's hair transplant. That's my world of hair transplant. It's become much simpler. It's still a full day procedure in my office, and that's okay. I have a team that just does that, and the rest of us do other things. And I actually am like the orchestrator conductor, right? And make sure that after I draw the hairline and get the patient all set, I don't have to do every part of this. I do some of it, but my team will do a lot of it. QR678 Neo is a revolutionary patented evidence-based biomimetic peptide-driven anti-hair loss solution. The nice thing for you all that have QR, I do not have QR in the United States, okay? But the nice thing about QR is that there's a ton of papers about QR, and we're going to talk about some of them tonight. So we'll talk about some of them. I'll let everybody else talk about it. This is a recent paper. We have some of the docs here, which was great. Using this solution for rejuvenation of the donor scalp and as storage media for hair follicle grafts during FUE hair transplantation. Fascinating concept, right? Using these biomimetic peptides, which actually will give some healthy characteristics to the hair follicles when we're preparing them. And again, I think that's really nice. So we'll talk more about that paper in a little bit. So what's new in hair loss treatments? How do we get people, what are we looking at? So this is something none of you have ever heard about, right? And I have permission to talk about this, so it's okay. So there is a company in the United States that is actually doing they're now in phase 3. So FDA, phase 1, does it work? Phase 2, looking at dose response curves and what's the right dose. Phase 3 is the pivotal, very big FDA clinical trial, 2 identical trials, and that's how they do it. And hopefully if it works, you get approval, right? The last hair drug that got approved was finasteride 30 years ago. It was called Propecia. And then that's long gone, and we have generic finasteride. But we haven't had a hair growth pill that has FDA approved in 30 years. So we are looking here at this compound, and it's low-dose oral extended release minoxidil, right? So why do we need this? So if you look at if you know the literature and you know the minoxidil story, people are giving low-dose minoxidil a lot now, right, as a treatment. But about almost 30% of patients are going to reach this cardiac activity threshold. And most doctors that give oral minoxidil, low dose, don't check blood pressures. They don't ask patients about health stuff. They just give them the medicine. So if we can keep everybody below this threshold and it actually grows hair, maybe we've got something. So this actually helps the conversion of minoxidil to minoxidil sulfate, and we know this is the mechanism. So they did a phase 1 study in healthy volunteers, and what you're looking at is the ones that go above and is an immediate release 5 milligram tablet. So we're seeing immediate release. When you take a tablet of 5 milligrams, you're hitting that cardiac threshold. If you take 2.5, not always, but sometimes. But if you take this new drug for, we'll just call it the new extended release low dose minoxidil, we're not seeing this effect. And so that has really been exciting. So phase 2 open label was 20 men and 20 women, okay, for a period of time. And again, we don't have to get into the study. But if you look at the results and when the patients reported a 2+ thing based on literature on the right, based on the studies for the men and women in the first 2 columns, no cardiac events, no suicidal ideations, which is something, if you believe that finasteride can have this stuff, I think it is, after 30 years of prescribing finasteride, I've never seen it, but it's out in the social media world, so you better know that if you're using this drug. But the hair growth here is double of what you see in the clinical studies. And you can't compare one without, it's not a comparison that's equal, but this is what we show. And here are the clinical results from the phase 2. So baseline, this is 2 months and 4 months data, photographs. What you see is a lot more hair growth, right? And actually, if it's going to work, it's really showing within a month. But what you see here is that everything we've had up to date, both minoxidil and finasteride, or topical minoxidil and oral finasteride, is vertex only. This works on the frontal part. And that was a surprise to all of us. When you look at the hair diameter and the number of hairs here, you can see what's going on. Here's another patient, and you see the baseline 4-month and the change in the vellus hair, patient-reported outcome. They didn't notice much at month 4. At baseline, I mean, they had much improved patient-reported outcomes. And this isn't picking the best patients. This was every patient. And you can see the thickness here. And we actually tattoo these patients, and we take the same photographs and so forth. Here's another patient. Again, you see the change here. So I think this is really interesting. And look at this person. Now, I'm not sure that I would think finasteride would do anything, right? Topical minoxidil is not going to touch this person. We all agree on that. But look at the change at month 2 and month 4, and just sort of the slide is over one, but it's really different, right? It's really life-changing for this one. Another patient here, this is I think this is a female. You see the changes here. So I think this is really important, darker skin individual and so forth. The phase 3 trial is 480 patients, right? So and there's a male and a female. The male study is closed. It goes on for over a year. The female one is enrolling right now. I'm part of both of them. I don't know the results. I can't tell you what. The other things that I'm going to go over, and I don't know how much time, Tanuj, I think I have 10 or 15 minutes left. Non-surgical hair loss, red light, right? We all use red light, all right? There's all kinds of red lights. It has an FDA approval, actually. Red light has an approval for hair growth, and I think that's great. But Revion Red is a different one, okay? It's red and orange together. And so again, I have nothing to, I'm not getting paid by Revion to tell you this, but it's different. And it uses an app. So it's a smart red light, and the coverage is a little bit more than most red lights out there. And it's a dual mechanism. So we get it because it's red, and using the orange, we're able to get more blood flow because of the nitric oxide that's released, and we get decreased inflammation. And this was a study that, if you're in the hair world, Rodney Sinclair is somebody we all know from Australia, and he did this pivotal trial, and you can see the improvement versus a sham device. So here's some of the Revion Red photographs, right? And I think this is useful, and it's something that, and now they actually did a study with this device in cicatricial alopecia. So I treat a lot of women with hair loss you biopsy them, it's cicatricial scarring alopecia. Don't be afraid to try things, because I'm growing hair in a lot of these people now. And I think it's great. So here's somebody with scarring alopecia, and you can see 2 patients, and you can see the improvements that are made. Exosomes are the big buzzword, right? What we know about exosomes is above the water, okay? Everything else is below. But I put a red line in because after 3 or 4 years of working with exosomes, I'm starting to learn more, or at least I think I am. It has a lot of publications out there, so you have to be careful. They are extracellular vesicles. And in 2017, the FDA in the United States told people to stop, because we had people injecting them in every body part and orifice that you can ever imagine. And as you see the bottom, they had reports of blindness, tumor formation, infections, and more, because they're not drugs. And most of these people that were injecting were not physicians. And the FDA blamed the companies and told them to stop and start to get some data. So again, we need to know a lot about these. We need to know what they are, whether they're umbilical or human-based or plant-based. Different parts of the world allow you to use human. Some have banned human growth, so you have to use plant-derived exosomes and so forth. So I'll show you 2 companies. This one is not in this part of the world. It's platelet-derived exosomes, and so that they have, and again, they like to say they have like 100,000 billion exosomes. I don't care if you have 5 exosomes, just so it's pure. I want pure exosomes. But they have different topical products they've developed, and they've developed a hair serum, which has the exosome, the platelet-derived exosomes, but all these other things in there. And each part of those, every part of that is derived or it was thought about to actually get hair growth started. So it follows different pathways. So it's not it's more of a concoction of different things together. They did some studies, okay? Again, Michael Gold likes clinical data. So they did some studies, and scalp coverage, hair density, volume fullness, hair breakage, everything improved. These are some of the pictures. and everything got better, right? So this is a really good, the amount of hair, the strength, coverage, everything improved. So these are some of the pictures from the studies. And I think that's important. And so patients were happy. Um, so I'm not, I don't, so maybe the other one will be in here or maybe not, but that's it. I like that one. If you're in the laser space, right, there's a new laser, okay? Um, Folix is from Luminous, and it's the only FDA fractional, non-ablative fractional laser that's cleared. It's a really a breakthrough because we're using your own body's natural ingredients to grow hair. It's it's a very quick treatment, no anesthesia is needed, and I think that's important. So it's a non-ablative coagulative array, and it heats up. This heating up to the mid dermis serves as a stimulant for an inflammatory release mechanism, fibroblast activation, new collagen, dermal remodeling, and increase in blood flow. So just think about it. If we do non-ablative fractional lasers for the face, we're creating channels. The normal skin helps that heal faster, but we're getting all this more blood flow, better skin. So we're actually getting better hair. In the hair follicle is getting improved this in the same light. And they've done gene expression analysis, they've done histology, and this is 3 treatments or 4 I tell my patients they need 4, but this is what you get. And I think, again, another option for those that don't want to see what I showed you at the beginning, but it also can be used for other things like alopecia areata, which I think is great. So that's my talk. I want to say thank you to the teams for letting me share all this with you. I'm going back live for a minute. I'm going to I'm going to turn it over to you now, right? All right. So I'm going to turn it over to Dr. Raji Patil, Head of Medical Affairs for QR678, who's going to share us a little information on something new with relation to QR, right? Okay. And then we'll come back and we're going to have this incredible scientific panel presentation. So when you're finished, Tanuj, you'll take back over to introduce the entire panel and so forth, and then we'll start asking everybody questions. All right? And
Agreed.
if you have questions, put them in the chat, right? So if you're anybody out there that has questions, please add them to the chat. So, all right. So Dr. Raji, you are up. Yeah.
So, very good evening to all of you gathered over here. Just a few introductory lines before my talk goes live here on the screen. So, at QR678, we believe that true advances in hair restoration comes from science, and science is rooted in rigorous research. So, adding to our treasure of clinical research, we have 2 new articles which have recently been published in journals. Just an introduction to both. The first one is a paper published in Stem Cell Research and Therapy, which is a journal with an impact factor of over 7, which decodes the key signaling pathways, WNT, SHH, Notch, BMP, and AKT. The second paper is on investigator-initiated trial published in the Journal of Cosmetic and Laser Therapy. This article or this paper validates QR678 Neo as a transformative adjunct in hair transplant surgery. Both these papers are going to be handed over to you as a small take-home reading material at the end of the session. And following this, I will play my presentation right now. जाने का मतलब
Apologies as we are having a little technical issue. Hopefully we will now get this up and running well. The audio feed is still not transmitting to the Zoom.
Dr. Tanuj, just give us 2 minutes, we'll fix it.
Okay. You might want to move on to the scientific panel and then come back to the sponsor presentation.
Yes, we'll do that. So we'll
Great.
go over to Mumbai.
Yes, okay. So I will introduce the scientific panel presentation section here. And apologies for the technical issue there. We will come back to Dr. Patel's talk later. So now we'll go ahead and begin the scientific panel presentations. Let me do a little deeper introduction to the 4 doctors I already mentioned earlier, who will be each speaking and telling us their expertise and really beginning this interactive portion of our session today. First will be Dr. Vinay Choksi in Mumbai. He's got over 15 years of hair transplantation experience. He's a pioneer in surgical excellence and innovation in hair transplants. He's going to present findings from the global study on biomimetic peptide solutions for donor scalp rejuvenation and graft survival, featuring QR678 Neo. Go ahead, Dr. Choksi.
Hi, good evening, everyone. It has been a pleasure to hear to Dr. Michael Gold regarding his excellent experience that he has in the field. And we did get to learn a lot of things today. I've been very closely following the research and application of QR678 for a long time and has been reaping benefits for my clients. And since we saw a turnaround for all the alopecia clients that we have for hair loss, and almost a 83% appreciation in growth was there whenever we were using QR678, and that research was also done. Then we decided to move forward and do it for hair restoration, which is the field which gives a definitive results to most of the clients. And hence we decided to go ahead with the study of evaluation of the efficacy of a biomimetic peptide solution, that is QR678.
To share ideas in real time. And to quote a famous 80s band, Cinderella, you don't know what you've got until it's gone. And the ability to share ideas in real time. And
Okay. Can I go? Okay. So rejuvenation of the donor scalp and as a storage media for hair follicle grafts during FU hair transplantation. So this study we did, and it was a prospective single-blinded comparative study that we did, and around 112 clients were taken from grade 4 to grade 6 Norwood Hamilton classification. So as we know, the gradation of Norwood Hamilton classification for male and female, mostly we get male clients. Almost 95% of the clients that we treat are males, and the classification that we have for hair loss is very obvious. In females also, nowadays it's rising thanks to the hypothyroidism and PCOD, which is increasing a lot in even young females nowadays. And we have to be very vigorous and thorough as far as female clients are also concerned. Luckily, QR is helping both the male and female population in reducing the hair loss and hair thinning and giving better results. So we decided to do a study wherein we had three stages. Before the transplantation, we used QR678 for like 3 sessions we did with a gap of 3 weeks. And then after the final session, we did after 3 weeks hair transplantation, and QR678 was used as a storage solution. As we all know, the whole differentiation we have of different solutions which are there world over, right from ringer lactate to normal saline to hypothermosol, and different solutions people are promoting. Even PRP is being used as a solution for holding the grafts. We decided to take QR678 as a holding solution, which a dilution of 1:5, and see how it helps get better results for hair transplantation. So that was a stage 2 where it was used. As we all know, FUT and FUE procedure has been a comparative study, but now most of the clients, the surgeons, they do FUE, which is the standard procedure for hair restoration. It gives a fantastic and natural results now. And FUT definitely is on the way out. And FUE is what we have been doing, and we use the solution for FUE. So as we know, the options that we have of adjunct therapies for hair transplantation, like we have PRP, we have growth factor concentrate, we have meso cocktails which are used. All this is done so that we have better and better results after hair transplantation. And as I told you, aware which solution is being used during the hair transplantation procedure. Group A was having QR678 as a holding solution. It was given before and after transplant, and the group B had a normal saline as a holding solution. There were 56 participants in both the groups. The inclusion criteria of 25 to 50 years was used because here most of the clients have a stable hair loss. They are not in the early stages where you have a hair loss which is just happening. Sometimes it's going very fast. If you take less than 25 years, more than 50 years would be not an ideal client, candidate for utilizing for research. That's why we took this age group. And we took people who were non-responders to topical minoxidil and oral finasteride at least for a 1 year time. The exclusion criteria were short-term hair loss less than 6 months, people having severe drug allergies, malignancies, autoimmune hematologic disorders, or seborrheic dermatitis, and people who had just recently started or stopped minoxidil or finasteride. So we did a baseline evaluation. We used global photographic assessment where 2 doctors were asked to have a blind review. One was a dermatologist, other was a maxillofacial surgeon. And based on their assessment from 0 to 10 scale, it was assessed. In the stage 1, we did 1 ml solution. It was injected intradermally, 50 to 60 injections by Napier technique in the thinning areas, and it was spaced 3 weeks apart. So we did 3 sessions before the transplantation. In the stage 2, local anesthesia was given as usually we do for hair transplantation with the anxiolytic. Graft were extracted from the occipital area, which is the donor area, using a 5x magnification and a micro punch. The graft preservation was done in QR678 Neo solution. The dilution was 1:5. We did the dilution so that we have enough solution for the grafts. Because sometimes we crossed maybe 2,000 to 3,000 grafts. We wanted more solution for the grafts that we have. And for the group B, the extracted follicles were preserved in normal saline. Implantation was done classically that we do. And in the stage 3, post-transplantation, in the group A, where QR678 Neo was administered, we gave 4 sessions with a gap of 21 days, 3 weeks apart, and that was a stage 3. The objective was to enhance graft survival, promote hair restoration, and improve the scalp health post-surgery. The following parameters were used to evaluate the outcomes at the end of each stage. One was the global photographic assessment. Standardized photograph, frontal, vertex, and temporoparietal area was used, graded by blinded reviewers. As I told you, two doctors did this on a scale of 0 to 10. 0 is equal to no growth, and 10 was thick growth. Video microscopic assessment or a trichoscopic was done. Proscope was used to analyze hair count, vellus and terminal hair counts, density, and shaft diameter at fixed scalp position. The results got were very amazing, astonishing, and promising. So in group A, as you can see, the baseline where we are doing global photographic assessment, we had better results in the group A where QR678 Neo was used as compared to group B where normal saline was used as a holding solution. As far as the trichoscopic goes, again, you can see the vellus hair, terminal hair, density, and shaft diameters. There's an appreciation in the group A where QR678 Neo was used before surgery, during surgery, and after surgery. As you can see, the parameters which you use, vellus hair, terminal hair, density, and shaft diameter, there is definitely appreciation. And we have a p-value of less than 0.001, which is a significant change that we got in group A. So as you know, hair loss can significantly affect the mental health, leading to increased stress, low self-esteem, and depression. We are always looking for better and better solutions to improve the hair growth post-transplant. So the current treatment that we have, minoxidil oral finasteride, definitely works fantastic, but definitely you need additional supplements for that. And sometimes they also have some side effect, but we carry with them. Role of PRP is definitely there, but as you compare QR6788, it's a standardized solution. There's no need to draw blood or having a different type of tubes to give better results, which is done in PRP. Though I appreciate PRP definitely has been giving results, but QR678 is very close and is giving a standardized treatment. So the biomimetic polypeptide formulation that we have, has a patent from USA in 2017 and 2019. And that's why we have been utilizing it for different purposes, including hair loss, for treatment for hair loss, and even for transplant, we are utilizing it now. It is being used as a graft storage solution. Effective storage solutions are crucial for graft viability. And the patented QR678 has definitely giving us an edge in the transplant procedure. As you can see the difference, these are the different stages that we did the whole research. First is the stage 1. In the before the surgery, we gave QR678 in the recipient area and the donor area. This is during transplant. It was used as a storage solution, and definitely we get good growth. Though we did just for 4 to 5 months, but as we saw the clients post 8 to 9 months, this is the result that we got. The limitations were that it was a single blind study, so maybe that can be an issue. Then only males were included. Then confounding factors like patient's conditions can be there, which can alter the results. We need more long-term studies to prove that it is a very good holding solution and it can give better and better results for all the clients that we are doing. So hair density evaluation revealed approximately 43% higher graft uptake in group A compared to group B, indicating superior graft viability with QR678 Neo as the storage medium. Now, this is a very good finding, and this has given us a lot of hope to carry on the research further. As far as the holistic approach is concerned, it offers a comprehensive solution addressing both physical and psychological aspects of hair loss. Thank you.
Thank you, Dr. Choksi. Appreciate that very nice presentation, very inspiring work you're doing there. I think I'll come to your clinic and try to get a little bit more density in my scalp here. Let's now move to Dr. Gosavi. Dr. Mahesh Gosavi is a Mumbai-based dermatologist and hair transplant surgeon with experience with over 3,000 procedures. He's a former assistant professor at the JJ Hospital. And today he will share clinical experiences with QR678 Neo. Thank you. Please proceed.
Hello, good evening, all of you. Today I'm here for one very quick response presentation regarding this integrating QR678 Neo with a hair transplantation in the interesting case of scarring alopecia. I cover my presentation under following headings. The purpose of this study is to evaluate efficacy of QR in scalp rejuvenation before transplant, acts as a graft storage medium during FUV transplantation, and compare the outcome with a conventional hair transplant method. I had one patient who had burn at the age of 4 years, who had extensive scarring alopecia involving frontal, parietal, and temporal region. These are the clinical photographs before transplantation. The patient had a severe thermal burn injury at the age of 4 years, leads to post-burn cicatricial scarring alopecia. Diagnosis is very clear. It is scarring alopecia. We did a pin prick test for assessment of scar vascularity, which is very bedside procedure, easy to do, and we show a compromised vascularity. The scarring area is well demarcated, involving frontal, parietal, and temporal region. What we did FUV hair transplant in that patient, and after extraction of the graft, we preserve that graft in a diluted solution with a QR678 Neo in 1:5% ratio with a normal saline, rather than doing conventional normal saline preservative medium. And following that, we implanted the graft into the recipient scalp area. Approximately, we implanted 2800 graft from the occipital side, that is the same donor side, which is a hormone independent part. Post procedure, after 3 weeks later, we additionally give 4 sessions of QR, which are 3 weekly apart, to increase the graft survival and to increase the outcome of the hair transplant procedure. What we get 90% of the implanted graft survival, and patient satisfaction score, we got 10 out of 10, we got a 9. These are the clinical photographs. You can just see it is scarring alopecia. You can just observe it is very pale area. It is less pinkish, less erythematous, having very compromised vascularity. And on the right side, you can just see post-transplantation patient's hairline, the maximum hair growth we achieve. Generally, in scarring alopecia, we got whatever implanted is 50% of the graft, it will get updated. But with the QR678 Neo, we got a good number of graft survival. This is the pre and post photographs. This is another view. This is right sided lateral view, and this is the second view. You can just appreciate nice hair density, nice hair growth as compared to the normal patient. This is another view. So coming to the short discussion, QR always enhances the scalp condition pre-transplant and increases the graft viability. It also increases the good outcome post-transplant because of anti-inflammatory effect and natural growth factors, which generally addresses the psychological and cosmetic outcome effectively. To conclude my short session, the QR is a promising adjuvant in FUV method as a storage media for scarring alopecia where the vascularity is compromised, because it has a nourishment media. Also, it acts as an anti-inflammatory effect, which generally increases the graft survival. Also, it increases the graft storage, graft uptake, and offers the holistic approach for addressing both physical hair restoration and psychological effect. So this is how short case presentation by me. Thank you.
Thank you very much. That was very impressive, some of the results that you got in those very tough cases. Now we'll move on to Dr. Imran Ali in Hyderabad. He's got 14 years of experience and has done over 4,000 hair transplant procedures, including scalp as well as beard, eyebrow, and mustache transplants. He's a former medical director in Riyadh, and he now leads the Dermax Skin and Hair Transplant Clinic in Hyderabad. We're looking forward to his talk on some clinical experience with QR678 Neo. Take it away, Dr. Ali. Thank you.
Good evening, everyone. I have been using this QR678 from few years. My study is based on the presentation which one of the panelist has done. So it is integrating QR678 Neo with hair transplantation in androgenetic alopecia, a case-based approach. So these are my contents. So we all know the timeline of hair restoration evolution. So early technique of hair restoration was the punches which were used. The punches were of big size, like 3 mm, 4 mm, which were giving the very ugly appearance. Later on, the concept of donor dominance has been introduced by Dr. Norman, and we have been doing FUT, and after FUT came FUE, and in 90s there was the introduction of pharmacological treatments like minoxidil for hair growth and finasteride in 1997, and later on PRP was introduced and it became very popular, and robotics, as Dr. Michael Gold has explained very in detail. And after this, we are going to a new era where we are using QR6678, and PP405 is also in study now. And next is the bioprinting of the hair follicles. So why I have chosen this approach was the limitation of conventional FUE, that is the variable graft survival, that is the lack of consistency in graft survival rates, and donor area limitations in some of the individuals who were having grade 7 baldness. So delayed density improvement, slower hair density improvement over the time in some of the individuals, and need for some adjuvants like biomimetic peptides. So QR678 is a biomimetic peptide with natural growth factor mimicry, and it has anti-inflammatory properties, and it decreases the inflammation in the scalp. It has scalp rejuvenating effects, like it promotes the health of the overall health of the scalp, decreases the inflammation, and it protects the hair follicles for better longevity and hair growth. My case is as follows: a 33-year-old male patient with grade 4A androgenetic alopecia who failed with minoxidil and finasteride treatments, and he was having more thinning in the front, and he was going into psychological stress. So I have decided to go for hair transplant. This is the photograph of the patient. So in the stage one, what I have done is I have done microneedling with the QR678 Neo. 1 ml of QR678 Neo in the donor and recipient area was given 3 weeks apart. 3 sessions were done, and it was given by nappage technique. It improved the scalp vascularity as well as a better terminal to villus hair ratio. And later on, the patient was taken for hair transplant. In the stage two, FUE, like any other hair transplant, hair grafting from the occipital region was done, and the graft were stored. This is very important. Grafts were stored in a diluted solution of QR678 1:5 with normal saline, and implantation under magnification with precision was done. This is after the transplant. So QR678 additional sessions with microneedling spaced 3 weeks apart were done after the uh, hair transplant. So the goals were to enhance the graft survival and promote early hair regrowth. So the workflow as follows: that is preconditioning of the scalp, extraction and the usage of QR678 for the storage and implantation, and post procedure QR678 for the support. And this is the outcome of the patient, and the patient was very satisfied and he is maintaining it. The result is being maintained very well. So QR678 Neo benefits are: it helps in the graft survival, that is superior graft survival rates, faster visible density. See, most of the patients after the hair transplant, they want a faster result. So it helps in decreasing the inflammation and improved healing, and both there is a psychological benefit and physical coverage of the grafts. So it is the integrative approach. Every follicle has a second chance if we combine biologic intelligence with technologic precision. So these are my references. So final thought is from evolution to revolution, a case-based roadmap to the future of hair restoration. Thank you.
Thank you, Dr. Ali. Appreciate your contribution. That's a very interesting approach. Thank you. And now we're going to move to Dr. Ahmad Youssef in Kuwait, who's joining us virtually. Dr. Youssef is a dermatologist, triple board certified, founder of the clinic AY. He has an affiliation with Harvard Medical School. He's an innovator with patents in PRP and laser technology. He will be presenting his clinical insights and experiences with QR678 Neo. Thank you, Dr. Youssef. Please unmute yourself.
Can you hear me now clearly?
Yes, now we can hear you.
That's great, great. So may I share my screen, please? Right. Okay. My screen shared now. Hello, can you hear me?
Yes, we can see your screen. Please convert to the
Sure.
slide deck presentation.
So thank you very much for the introduction. I will share my very recent experience with the QR678 and the hair transplantation protocol. I'm doing a lot of cases for secondary cicatricial alopecia, okay, especially after the black market, because we do have a lot in the region and the Arab region and Middle East region, where a lot of technicians doing cases for hair restoration, and sometimes we are suffering with what we see in the donor and what we see also in the recipient areas to correct these issues. So I'll move fast. This is my disclosure. I guess that you already spoke about a lot of it. All right, and let's go to the introduction. The hair restoration surgery as a solution for advanced grades of androgenetic alopecia where there is absence of follicle or for revival. Okay, it has been very well known. All of you have just introduced about it. The FUE is preferred for the minimal scarring because as long as it's done in a good way.
Wait. Go to the little icon at the bottom right where we can see your slides, because all we still see is the intro, is the title. So go over to the right, move your cursor to the right, and get on
To the right, like this.
Yeah, so you see the four
Now it's
little
working.
icons.
Now it's going on.
We can see the slide carousel, but you need to start your slideshow. So you can do what Dr. Gold mentioned, which is click on the bottom to start the slideshow, or you can go to slideshow on top and hit start slideshow.
Yeah, see, it's probably easier, go to the top. Go to the top where it says slideshow in the middle there.
Okay.
Take your cursor,
Here.
we got, go all the way up. Go to the left a little bit.
One, okay.
You see it says slideshow?
I see stop sharing. Okay, and then I will correct it again. So may I share the screen again here and allow it to me?
Share
now it's clear. Share.
You cancel your screen share.
Okay.
There we go. But
Now,
you need to start the slideshow.
Now, is it there?
Yes, but you have to have right there. Hit that.
This one?
Yes.
Yes.
All right. So now it's clear, huh?
So that you're on the slide that says patient profile. If that's okay.
Yeah, okay. So we will go to this one, okay?
Perfect.
Now
Thank you.
Yeah, good. So now it's clear about the background. So for the FUT preferred in larger areas of hair transplantation. However, also we have seen a lot of cases with FUE where we sometimes see a great scarring over the donor area if we are doing over harvesting, or if we have cases with over harvesting from the black market, or if a large bunch is being used. And this is the case that I will present today. Okay, a combination, of course, sometimes is needed, but it depends according to the patient stage and the patient age also. So for this patient, this was actually 22 years old male, okay, who was supposed not to do a hair restoration surgery, because usually by laws in American Board of Hair Restoration Surgery, we don't like to go for hair restoration before the age of 24. So this patient actually has done the hair restoration while he was only 20 years old. And as you see here, the hairline doesn't look this satisfying for the patient, because a lot of the hair, which was already existing, okay, has fallen. So the patient now, instead of looking like a frank grade 4 or grade passing to grade 5 androgenetic alopecia stage, he looks like a case which we name diffuse patterned alopecia. It's due to the hair transplanted over the frontal area while he was 20 years old. So such a patient, the challenging point about him is that we need to do such a correction, okay, while at the same time we need to do the best to preserve the donor area for this patient. This patient was non-compliant to minoxidil before and after his first surgery, of course, and he has a dominant androgenetic alopecia family history on both the maternal and paternal side. So I will move to the diagnosis for such a patient is grade 4, progressing to grade 5. Yes, but here is how he looks like. I guess that you can see the cursor over this small window area, which I will make it larger now in the donor, while the donor itself is not that healthy enough, plus they have a window where they do the extraction and the over harvesting through. So when we examine him using the trichoscope, we found that we have a lot of scattered fibrotic spots all over the occipital, bridal, and frontal areas due to this over harvesting. And plus, they were using a large size sapphire for the implantation in the recipient area. And this is why he wasn't satisfied with how his frontal hairline looks like. When this patient came to my clinic, he was all the time wearing his cap on because he can't take off the cap. He doesn't feel satisfied. He doesn't feel confident enough to take the cap off. And if we just make it larger a bit, I guess here it's clear that this area looks of lower density than the others. So the point for us and the challenging point is how to do more harvesting to correct this patient, while at the same time we want to correct his hairline and keep the donor area for the future because he's still 22 years old. So the technique we choose was FUE. We suggested only 1,000 grafts because we don't want to do more and more harvesting in the area. A pre-transplant session, we just did 2 sessions in 4 weeks intervals using the QR. The expectations was discussed for the patient to confirm that he understands that the issue is his age, that we cannot go for a very, very high density with the hair restoration, while at the same time he's still 22 years old, and we don't want to consume the donor in this age. And the rationale for this was to combine the non-surgical and the surgical hair restoration modalities, because we told the patient that what will go on with him in this stage is that we need to go for non-surgical hair restoration modality to keep the hair that's already there and to correct what happened before 2 years ago when he did the other session in the black market area. So what we did was using the microneedling topically together with the QR678 in the donor and recipient area. We used it for both because we want also to correct over the donor area. We did 2 sessions, split 4 weeks apart, okay? And the purpose was to make conditioning and promotion for the hair follicle rejuvenation, either for the donor area or for the already non-implanted hair in the recipient area. And then we prepared it later with the surgical laser. Okay, this type of laser, we prepared the holes. We do a microslits with the laser-assisted microfracture transplantation, tricoscan, and we implanted only 1,067 grafts, 122 singles, 705, 240 triples, which is considered like a minimal count. Okay, we kept this stored in the QR678 in a ratio of 1:9 with the normal saline solution. The donor area and recipient area in this area, while we have a low density to be avoided in the recipient area, we care most about the correction for the frontal hairline and the forelock density to achieve a natural appearance, because this was the main complaint by the patient. And of course, we have done this under a nerve block anesthesia. The whole procedure took 4 hours, no more. So this is how the patient looks like immediately after we get done with our surgery. Okay, these microfollicles, because we have used the small bunch, it was the 0.85 millimeter bunch. Okay, and we just, as I mentioned, we make the most of our hair restoration was over the forelock and the frontal hairline to correct this appearance. For the wound care protocol, he used the regular normal saline solution spray and the graphite shampoo. And for the follow-up, we have done another 2 sessions of QR6781 milli for using the microneedle radiofrequency again. The instructions, the regular instructions were given for the patient regarding his activity, his sleeping position, and hair washing to be avoided using the regular shampoos for the first months, and to do the rate of the scalp care guidance. For the outcomes, this popping out of the recipient area due to fibrosis was helped to be just operated by the laser pre-made slits, together with what we have done with the radio frequency with the QR678, because we had softening over the areas over in the donor area and in the recipient area also, because we need this to minimize the popping out. The timeline for progression, we followed the patient for 1 year. The patient satisfaction score was 7 out of 10 regarding the whole dynasty. He was dreaming of higher dynasty. However, we didn't get a huge number of grafts. We rely on only this 1,067 graft plus the QR678 for the already existing hair. But for the hairline, he was 10 out of 10 satisfied because he's no more wearing the cap. So I will show now how the patient looks like over here, okay, where the area we did most of our hair restoration. The other areas, if you go for the second slide, in which we rely more on the QR678, and this has better result over these areas. And this is how the patient looks like after 1 year. If I just go back another, this was a 1 year result. Thank you very much. I hope my sharing for this recent experience has been beneficial. Okay, and I hope to see you all again. Hello?
Yeah, thank you, Dr. Youssef. Really appreciate your contribution. That's a great case report. Okay, so Dr. Gold, I just want to check the temperature in the room there.
We're having a great
Mumbai.
time.
Great, great.
We're having a great time here. So
Fantastic. So should we go back to
we're gonna do
Dr.
the
Patel
panel.
presentation, or should we do some Q&A?
We're gonna do the panel.
Okay.
We're gonna answer some questions from the audience, and then if we have time, then we'll go back to the QR little 4-minute video. It's only 4 minutes, so it's not long.
Great.
All right.
Okay, so we can do that at the end.
So I'm going to take our esteemed panel, and I have a question or two for everyone. And please answer them succinctly, and let's make them short answers so everybody we can get all the questions in that we have. So I'll use your first names. It's easier for me, okay? I don't want to mess up anybody's name. Dr. Kavish, first question. In your experience, how has the integration of advanced hair transplantation instruments, what? Oh, he's coming up here. He's here. You're coming up here. I need the mic, right? Okay. All right. So yeah, Dr. Kavish is here. Welcome.
Hi, sir. Hi, Dr.
Welcome. All right. So in your experience, and can we get the camera to make sure we're on him as well? You don't need me. How is the integration of these advanced instrumentation and for FUE system influence the balance between surgical artistry and extraction efficiency in advanced hair transplantation? And where do you believe the irreplaceable signature of the hair transplant surgeon still lies? So it's a hard question. Are we being replaced? Okay. Do we need us? Is the question.
Yeah, so first I will answer the second part of your question. So what is the irreplaceable signature? So that I would say is how masterfully and naturally you design an artistic hairline. that actually can never be replaced by any kind of system. So to create a completely natural pattern, you will always require an expert hair transplant surgeon. So whenever patient comes to us, we see that how good that hair transplant is. We see by seeing that how natural that hairline looks and how dense it is, how well it has been crafted. So that I think will never be replaced. So you will always require a good quality hair transplant surgeon. Secondly, in terms of advancements, sir, now the in recent times, because of the advancements in machinery, there has been significant advancement. One of them is that now we have technology of long hair FUE. So it is now possible to plant hair with its entire length without any kind of trimming at all. So that we can plant hair with its full length. There is no need of trimming at all. So that allows patients who don't want any downtime and who wants more instant response. So now with long hair FUE transplant, that has become possible. Now, in terms of machines also, previously, most of the hair transplant surgeons were using just the usual motors, which primarily work only on rotation. So you basically are drilling holes. But now we have lots of advanced FUE systems which can combine rotation, oscillation, and sonic movement in the same device. And now we have intelligent punch navigation systems, so which can go in at a certain depth, then it automatically stops once it encounters a particular amount of resistance. And this allows us to more efficiently extract grafts from any part of the body, including beard, chest, abdomen, and other areas. So we can take hairs very efficiently from everywhere.
Is there, all right, maybe it's off protocol. What's the name of the long hair extractor device?
So there are many devices. The
Are
one
there? Okay.
which I currently use is the Dr. Ugraph Juice system. But there are some other devices also which can do the long hair FU extraction. So we have Trivellini system, WAW system. So there are 3, 4 advanced FUE machines which can do this long hair FUE extraction quite efficiently.
Thank you. Dr. Ahmed, hi in Kuwait. What is
Hi.
in your opinion, what in your opinion is the most significant advancement that we've had in surgical hair transplantation surgery in the past decade? So if you had to pick one most advanced, what is the most advanced thing we've learned?
In the
Significant.
surgical. In the surgical.
Yeah.
In the surgical, okay. I guess that the long hair devices is the most significant because actually this is what we were in need for. As just mentioned a while ago, okay, a lot of patients is dreaming about doing the surgery and just flying out, okay, with the hair there. So for the devices that we have seen during the last decade, like Dr. Yu, for example, okay, is one of the best. I myself, I've gone recently for this. I've been practicing like 20 years, but during the last 5 years, I've moved to the long hair also.
Great. Thank you. All right. So the next one, Dr. Vinay, for you, what unique benefits does QR678 Neo provide for graft survival and FUE hair transplantation compared to the conventional storage solutions, which is something I think we covered, but I mean, can you sort of give us your feel on that?
Basically, it's a biologically active solution as compared to normal saline or ringer lactate that we use as a holding solution. So it has growth factors, nutrients, and antioxidants in that solution, which gives a better result.
Good. Okay. And Dr. Mahesh, in your casework that you showed, you achieved nearly a 90% graft survival using QR678. How do you see this solution changing the way we approach difficult cases like scarring alopecia?
In scarring alopecia, we have a compromised vascularity. So, in my opinion, first of all, QR adds anti-inflammatory effect to increase the graft survival. Second, it can induce some kind of angiogenesis to increase new blood vessel formation, to increase some kind of vascularity, which ultimately yields a better outcome in scarring alopecia.
Good, thank you. Dr. Imran, considering
Yes, sir.
current advances in tissue engineering, what role could bioprinted hair follicles play in addressing challenging cases such as congenital alopecia, cicatricial scarring alopecia, or androgenetic alopecia in patients with poor donor reserves?
So this is a little advanced question. Most of them are in study. So here I would like to tell about two things, that is genetic cloning and 3D bioprinting. So genetic cloning is to expand the follicular stem cells, that is the dermal papilla cells, to create new hair follicles. 3D printing is printing the whole hair follicular structure. To give an analogy, I would like to explain that this is like genetic cloning is like pen drive with the information. This mere information is not sufficient. So 3D bioprinting is printing the whole hair follicle. So the most important challenge will be the vascularization and innervation of the hair shaft.
Great. Thank you very much, Dr. Navnit, who's with me here in Delhi as well. In hair transplantation, how does AI augment preoperative planning through diagnosis, donor assessment, and outcome simulation compared to its intraoperative role in enhancing precision graft survival and real-time execution?
Yeah, so it's very complex that, but as sir has already mentioned, that nothing can replace the perfect surgical skills.
Wait, hold on one sec, right? That makes okay. Start again.
So
Yeah. So nowadays, this is frequently asked in many conferences and events. So what I've seen is, as sir has already mentioned, that natural hairline skills by a surgeon, experienced surgeon, can never be missed, definitely. But nowadays, what we are seeing is like there are many applications available for hairline designing, graft precision placements. So recently I've seen gone through a app which is Scalp Scan AI, which is a commonly used. Even I use that in my clinical setup. So with that, we can do the perfect graft precision, placement, density, designing. Along with that, as you talked about ARTAS, nothing better than ARTAS nowadays, as we can see. We can extract the right number of grafts if we want to take out the single grafts or maybe do hair grafts or three hair grafts or maybe two out of four. So that is quite precise. That saves surgeons time. It's more convenient for us. And along with the designing, even now AI is there in the placement. Some machines are available for the placements as well, along with artists. So I guess AI can play a very good role, but definitely surgeons' involvement is mandatory. That can never be missed. As far as we are talking about the natural hairline and good results.
I do think whether we like it or not, AI is here. AI is going to change how we have to think, and we have to. I always tell people in my world of the dermatology and aesthetic world, um, there's AI systems out there that work to tell me what the proper procedure should be on their rejuvenation process, right? Some of it I think is okay, but if we don't use our eyes and our intelligence as the doctors, then it's silly, right? But the people out there that are not us are going to rely on that, and that's when I think AI is too much because they're going to get in trouble, right? And in medical dermatology, we have AI systems that will tell me the percentage of this mole being a malignant melanoma, right? And if it tells me it's a 78% chance of a melanoma, big deal. I already knew that. If I think it has to
Yeah,
go,
true.
if I think if it has to go as a potential melanoma, I won't let the patient leave my office. And I hope I'm wrong more than I'm right. But again, it's our clinical skills and it's what we've learned over a period of time. So AI is here, and AI is going to be part of everything we do. I think for artists, it's helping me, but it's still not replacing my hands and my mind and my design and how we place the graphs in my office. So I think that's all important. All right, so I want to thank the panelists, but I have questions now. So I'm going to go. I haven't seen these questions yet. Most of the time, I've seen all the questions beforehand. Okay. So I'm going to go down these, and again, any of the panel, please jump in with an answer. So if you want. So how may I know the wavelength of the full wick? So it's a 1550, I think, is the nanometers on full wicks, right? It's a non-ablative fractional at 1550. And how is it different than other fractional non-ablative lasers? It is a fractional laser that has been sort of designed for this role. And so it is 10 minutes of a procedure, 10 to 15 minutes, no anesthesia. And so it is different in how it's put together and how we use it. But in the end, it is a fractional laser, and it's the first fractional laser that's ever applied and gotten an FDA approval for hair growth. So I think that's important. All right. We wanted comments on, all right, so safe and Trevellini hair transplant systems, okay? And then artist is too expensive to purchase. I'm a very expensive provider to get hair transplants with. So yes, I agree with you 100%. Artist is expensive, but it is, as you said, it is the epitome of hair transplants, but it's an expensive machine and I charge accordingly if they want it done. But please tell me about the others because I don't know them. So
Yeah,
Safe
so
and Trevellini.
first of all, in this regards, my opinion is when you talk about ARTAS is currently the only FDA approved robotic system. With that, but in my personal opinion, there is almost no step which ARTAS can do better than an expert human hand. So in general, what I would always believe is an expert hair transplant surgeon will always be able to give better results than what ARTAS will do. ARTAS definitely adds as a marketing tool. It significantly adds to the marketing value. And if patient specifically wants a robotic hair transplant, and if you have it, nothing better than that. So that certainly is one of the options. But if you want to enhance your hair transplant skills per se, it would be better for you to acquire an advanced FUE system, which will improve your hair transplant skills in general. So amongst the many advanced FUE systems, I currently prefer to use the Juice system, this Dr. Ugraf Juice system. Trivellini system probably will be a close second. Safe system is way behind than this in terms of quality and expertise. So I would rate amongst the advanced FUE systems, I would suggest to go for either the Geo system or the Trivellini system. This both now they have customizable options. So with Geos also, say suppose you have to extract hairs from beard or from back area or from chest area, it has preset parameters which can allow you to directly extract from that body part very efficiently. So this has went down so that there is this machine which is helping you to make your procedure more efficient and more better. But remember, it's you who has to operate it. You still will need to fine tune it, but it significantly will help you in achieving this. And once you do perfect parameters, you will achieve nearly 0% transaction even while doing body hair extraction.
Thanks. Okay, so there are a lot of machines out there, right? Yeah. Cheap machines are cheap though. And so again, I just always say that when I talk about energy-based devices in general. And so make sure it's just a quality machine. And again, if it's a quality machine, it's going to work, right? All right, this is are exosomes derived from autologous blood, such as MCT, mesenchymal cells over umbilical or plant or for hair. So the reality is the human source, whether it's mesenchymal, umbilical, they work. The reality is plant-based exosomes work. There are enough studies out there now, this wasn't the case several years ago, that any of this stuff worked. It was like all over the map and people weren't understanding, again, they weren't understanding. What I tell people about exosomes, whether they're human-based or plant-based, first figure out in your country, in your region, are you allowed to use human or not? If you are not, like in the EU, you cannot use human, so they only can use plant. The second thing that you have to find out is, are you allowed to inject or are these only topical, right? And if it's topical, can you use a device like microneedling or Folex or whatever out there? I use Silpherm X as a lot when I do this as a microneedling device. If you create channels, the topicals will get in. But you have to make sure you can do that in your country. There's much more literature on human-based than plant-based. There's very little on plant-based, but they're starting to come more and more because more and more regions of the world, there's lots of places in Asia you have to use plant-based. So we're finally getting the data to show that it works. So again, they both work. All right, so the next question, would results vary between nappage? I don't know what nappage means. Do you know what nappage means? Okay. I'm gonna let one of you answer this. Would the results vary between nappage and deeper injection method for any hair growth therapy, such as GFC, QR678, or exosomes? Is there any clinical or anatomical evidence for preferring one over the other? Any one of my people online want to take a look at this? Dr. Imran, what do you think? You're on mute. You're on mute. You're on mute. Okay.
These are all biomimetic peptides, so it should be given or injected at the level of
Almost
the
done.
hair follicles. And I did not get the question
Good.
clearly.
Good. Two more. Good.
Cheers.
Okay. Go ahead.
Napaj technique, sir.
I was doing something away for a sec. Tell me again.
Uh, the question is either Napaj or deep injection, right?
Yeah.
Yes.
It is the Napaj technique, sir.
Okay. All right. All right. We're going to move on for a sec. So, dermatology question. Hair growth treatment options for patients diagnosed with discoid lupus, having bald inflamed patches on the scalp. What would you do?
So first is obviously the medical treatment and to stabilize the disease in those cases. So we use topical steroids or topical calcipotriol or tacrolimus calcineurin inhibitor solution to stabilize the disease. Once the disease is stable, then one can consider going in for hair transplant in these cases. If it is required, if the patch is completely bald, then one can consider going in for hair transplant if it is required. And if the scar is too atrophic, mostly with normal scars, you can directly go ahead with hair transplant. But sometimes with some of the diseases, what happens is that the area, if the scar becomes very atrophic, that you have very limited amount of subcutaneous tissue to hold the graft. In those cases, it is better to do a fat transfer first, build some subcutaneous tissue in that area. Along with that fat transfer, you can add some other regenerative therapies, maybe PRP therapy or maybe QR. Along with fat transfer, you build some subcutaneous tissue and then do the hair transplant.
Perfect. All right. We're going to do one more question and then move on. And the last two, they were the same question. So, when is the time to go from medical to surgical in the hair world? And we'll let you start here. And then everybody can pipe in if for a second.
So what I believe is initially I always start with the medical treatment, topical minoxidil, oral finasteride, and if any the race relative therapies if required like PRP, GFC. Nowadays, as per with the availability of exosomes, QR678, they are very good options. If someone is non-responding or responding very less, or if someone is fed up with the medical treatment, so maybe I'll wait for 1 year or so. And if they are not responding, the roots are not still not revived, then we go for hair transplant. But the baldness has to be there. Otherwise, we don't go for it.
Yeah. I mean, even when my patients come to me and they come for a hair transplant, you do that history, right? What have you done before? Well, I tried minoxidil for a month, all right, topically. It didn't work. So I need a hair transplant. And I sort of walk them through what I call the journey, the up the staircase journey to where you want to be. And some people want to start higher than other people. But if you don't start and offer the options, right, I don't think you're doing anybody a service. So I think using what we have is important. Having said that, somebody comes to my office and they've had everything, then I don't even start. I mean, the first thing I do is I will let them learn everything about hair transplants, and then they'll decide when it's time to do that. Right. And I think that's a good way to do it. So So that's where I'm at in how I deal with it. Anybody else want to make a comment on that?
Yes, so, sir, I would like to add in this, there are two aspects which I always explain to the patients. So, when they come for hair transplant, one is that protecting their existing hair. So, they already must be having some existing hairs. Protecting those existing hairs will require medical treatment and the regenerative therapies. Uh, and the second option is to get new hair roots, which we do by hair transplant. And in almost all of the cases, you will require to act on both of the things.
Mhm.
You will require newer hairs for which you go for hair transplant, but at the same time, for protecting your existing hairs, it's very important that they continue medical treatment and regenerative therapies. They need to focus on both the aspects.
And I think it's also important in this journey to let them know after you all do your hair transplants and I do my hair transplants, they still need medicines.
Yes.
They still need something,
Yes.
whether it's medical or non-medical, they still need something because life happens, they're still going to age, they're still going to lose some hair. And, yes, they may need a second or third hair transplant down the road. And that's fine. But in between, we try to maintain what they have as best as we can, right? And help those new grafts to grow, and like you just showed in all the presentations here. Okay, I'm going to stop with that right now. I thank all the panelists. Dr. Raji, come up now if you don't want to do it. Okay, Tanuj, I'm turning it back to you because I think we're at wrap-up time.
All right. Well, as always, these sessions are just so much fun to participate in because we have a real bringing together of the minds and people from throughout India and in the region, all who have separate practices and experiences. We get to share and hear from their ideas. I found the session to be particularly informative. I took some notes for myself, and I don't do a lot of hair transplantation in our world, in our practice, but we refer patients, and we have wonderful dermatologic hair transplant surgeons in our area. And all the technologies that were discussed today are in the conversation that happens with my patients. And so the future is definitely bright. The contribution of technology, both biologic and AI-based mechanical, clearly is going to continue to raise the bar and revolutionize this field. It's a great time to be in this area. We want to thank all the speakers, the panelists, and everyone who helped to organize the session. It is quite an effort in multiple cities with multiple ballrooms. The only sad comment I have to make is that I'm here in the United States while you guys are all going to go have a lovely dinner and celebrate with some cocktails after the session.
I'm going to the airport and getting on an airplane.
Oh, okay.
And then I'll be in Austin in less than 2 weeks, by the way. I forgot
Let's
to tell you
connect on
that.
that. Let's connect on that. Perfect. Well, with that, we will wish everyone a good night in Asia. Those who are in North America, happy Sunday morning. And we look forward to additional sessions. And of course, keep track of us on social media. We'll announce additional sessions because this will continue. We'll also be doing, in addition to our hair talks, we have aesthetic talks that we will be featuring soon in the world of non-surgical and surgical aesthetic facial rejuvenation. Thank you, everybody.
And wait, don't leave yet. Please
Yes.
kindly mention to download your certificates. At the end, when we're done, there's a link or something. You'll get a certificate. Thank you. Thanks, Tanuj. Thanks, everybody on the panels. We appreciate you all very much.
Thank you.